USMLE-style question on anemia in lead poisoning. A 5-year-old boy is brought to the clinic by his parents due to fatigue, poor appetite, and irritability over the past few weeks. His family recently moved into an older house built in the 1950s, which they are currently renovating. On examination, the boy has pallor and mild developmental delay. Laboratory results are as follows. Hemoglobin, 9.5 gram per liter. Normal, 11.5 to 15.5 grams per deciliter. Mean corpuscular volume, 72, normal, 80 to 100 fefilers. Serum iron, normal. Total iron binding capacity, normal. Zinc protoporphyrin, increased. Peripheral blood smear, basophilic stippling of RBCs. Which of the following best describes the mechanism of this patient's condition? A. Defective globin chain synthesis leading to microcytic anemia. B. Autoimmune destruction of erythroid precursors. C. Inhibition of ferrochelatase and ALA dehydratase, impairing heme synthesis. D. Decreased iron availability due to chronic inflammation. E. Impaired incorporation of vitamin B12 leading to defective DNA synthesis. Answer C. Inhibition of ferrochelatase and ALA dehydratase, impairing heme synthesis. Explanation. This child has lead poisoning, a condition that causes microcytic anemia due to disruption of heme synthesis. Lead inhibits two key enzymes. Ferrochelatase prevents incorporation of iron into protoporphyrin, increased zinc protoporphyrin. ALA dehydratase inhibits the formation of porphobilinogen, accumulation of beta-aminolevulinic acid, ALA, Sonfran. Key findings in lead poisoning. Risk factors. Exposure to old houses with lead paint, environmental exposure. Symptoms. Fatigue, irritability, cognitive impairment, abdominal pain. Microcytic anemia, basophilic stippling, ribosomal aggregates in RBCs, increased RBC protoporphyrin levels. Why other options are incorrect. Option A, defective globin chain synthesis, describes thalassemia, which presents with target cells and an increased RBC count despite anemia. Option B, autoimmune destruction of erythroid precursors, describes pure red cell aplasia, often due to parvovirus B19 or thymoma. Option D, decreased iron availability due to chronic inflammation, describes anemia of chronic disease, which presents with low iron and low T. Option E, impaired vitamin B12 incorporation into DNA synthesis, describes megaloblastic anemia, which presents with macrocytosis, high MCV, hypersegmented neutrophils, and neurologic symptoms. Thus, the correct answer is C, inhibition of ferrochelatase and ALA dehydratase, impairing heme synthesis.